Hey, shout out to Dusty Rhodes Coffee. Join me for a cup of coffee or your favorite beverage as we talk about all things retirement on this channel. And this is going to be a big topic. And let me preface this. I'm just going to share my own personal experience with Medicare and healthcare coverage for retirement. And I'm no means an expert. And you should always consult with a professional insurance agent about your needs, which could be totally different than mine. I just want to share my experience. And then I'm going to begin with this. When I was younger, I thought Medicare was free. And I thought once you hit 65, jackpot, you're going to have great insurance and it ain't going to cost you anything. How wonderful can that be? Boy, was I wrong. I was really, really wrong. And so that's what I want to talk to you about. My experience with getting Medicare for my wife and for myself and the various costs. And let's talk a little bit about the options. And I know for a lot of you thinking about retirement, it can be very, very confusing. And that's why you should always talk to an expert about Medicare. But this is my experience. First off, it is anything but free. Secondly, it can be extremely confusing. And three, you need to budget some serious savings for health care when you retire. Unless you've got something like my brother-in-law is retired from Chrysler Corporation. And so they're actually subsidizing his health care quite a bit. And so he really doesn't pay a whole lot out of pocket for health care coverage. Whereas my wife and I, it's a whole different ball game. All right. So I'll tell you what I understand about Medicare. And if somebody wants to jump in and say, Bruce, you're wrong about this or that, fine. I thought this would be a channel where we can all share the challenges of retirement as well as the benefits of retirement. So, Medicare, there is Medicare Part A when you're 65, we signed up for, which is free, by the way. That there is no charge for Medicare Part A. That is your hospitalization coverage, and it covers hospitals, nursing homes, some in-home health care, and I think that's pretty much it. But it was never designed to pay the whole bill. In fact, I think you have, for the first 60 days, there's almost $1,700 deductible. And then they pay 80%, I believe, of the bill. There is no cap on out-of-pocket expenses with Medicare Part A. So if you had a very lengthy illness or accident and you found yourself, in the hospital for, 70, 80, 90 days, for a long period of time, you're going to have a huge bill, even with just paying 20%. Then there's Medicare Part B. That's your doctors. And they also cover things like certain medications and what's called durable medical equipment. And that also covers 80% of the charges and has a deductible, and there is no limit to your out-of-pocket expenses. There is a premium for that. And my wife and I both pay $175 a month for Part B. So that is $350 per month. That is taken out of her Social Security check. And I'm not claiming Social Security yet. So I'm actually paying quarterly $500 plus every 3 months for my Part B premium. But together, we're paying $350 a month for Part B. Well, then there is what's called Medicare Part D, as in David. That is a prescription drug program. And for us, neither one of us are paying a premium right now for Part D. And premiums can change all over the place. You need to talk to an insurance professional. And I think around October is when you pick out and you can change Part D plans. There's no underwriting or anything like that. But there is deductibles with that. And our deductibles I know for next year are going to be $590 a piece. That works out to around $90 a month. just that we have to put back to cover our deductibles for our prescription medications. Okay, supplements. So you can purchase, when you get Medicare A and B, you can purchase what's called a Medigap plan. So Medigap is designed to pick up what Medicare doesn't pay. And that's great. And that's essential coverage, because there's no way, for example, last year, my wife, her total health care bills came way over $300,000. Now, what's 20% of that? That's what, $60,000 if we didn't have a Medigap plan. So the premiums for those, me and my wife have different Medigap plans through two different insurance companies. She got what was called the F plan. That was considered to be the Rolls Royce of Medigap plans. You pay no deductibles for your Part A or Part B, period. You should never see, according to my insurance agent, you should never see a doctor or hospital bill. You're not required to get pre-authorizations anywhere. You can use any doctor or hospital that you want. And that's the benefits of these plans. Now, I have the G plan, as the F plan, unfortunately, was canceled right after my wife qualified and got hers. So she's grandfathered in. However, I have to go the next plan called the G plan. And there's a different, you can actually get these plans with deductibles. Higher deductible means lower payment premiums, but you don't have as much annual out of pocket. And there is caps and so forth. But I got the G plan, and I have a $240 a year deductible, which works out to $20 a month for budget purposes. So the free insurance that I thought was free, $350 for Part B, another $279 a month for my wife's Medigap plan, $112 a month for my Medigap plan, $90 a month worth of Part D prescription deductibles, and then $20 a month for my deductible for my Medigap plan, over $851 a month. So if you multiply that times 12, you're going to get $10,212 a year for what I thought was free insurance. So you can see that's a big part of a retiree's income is going out just for this healthcare. And let's talk about these Part D plans. Big changes next year. Your total out-of-pocket spending, including deductible and co-pays, shouldn't exceed more than $2,000, which is about $330 some a month for your medications. Because right now, with my wife's health Part D, she paid the deductible, and then she has to pay on certain medications 25% of the cost. Now, she takes two very expensive meds. One is around I think they're both around $600 a month each. Okay, so about $200 to $300 a month we're paying out of pocket, in addition to all this, for medications. So you can see where this takes up a huge amount of money. So what's the alternative? Is there an alternative to this? Again, if you don't have some type of employer-sponsored retirement healthcare coverage, okay, you can have a spouse that's working, you're on their plan, you don't have to take Medicare, which is what a brother-in-law of mine did for many years. His wife worked outside the home and had health insurance, and he didn't have to do this. Okay, what's the alternative? Well, it's called Medicare Advantage Plan. And I'm here to tell you, in my opinion, just my humble opinion, it should be called Medicare Disadvantage Plan. Now, how is that? Because there's basically two types of Medicare Advantage plans. One is you're assigned to what's called a HMO, or a Health Maintenance Organization type plan, or there's a PPO, which is a Professional Provider Organization. The difference being between the two, with the HMO-based Advantage plan, you're limited to the doctors and hospitals in their network, period. You go outside of that, you're going to be responsible for the bill. If you travel out of state, you probably don't have coverage unless it's some type of emergency type of thing. With a PPO base, you can use other doctors and hospitals. I don't think pre-authorizations are required, but you're going to pay a higher premium for the Part C. That's what a Medicare Advantage plan is, by the way. It's called a Medicare Part C. And that combines Part A, Part B, and also Part D in most cases. Some of them will offer extra perks such as a little bit of dental coverage, a little bit of vision coverage, maybe even some hearing coverage. By the way, and I forgot to mention this, traditional Medicare is really skimpy. It does not cover your hearing aids or hearing loss. It doesn't cover glasses and eye exams. It doesn't care. It doesn't pay for any dental work. So you're paying all this premiums, and you still have essentially kind of skinny coverage. And folks, I'm here to tell you, it's not going to get any better anytime soon, because I just don't think we have the will right now politically to make these drastic changes that seniors definitely and crying out that they need. Just, I don't see that happening. But why do I call Medicare Advantage plans disadvantage plans? Well, if you do the HMO route, okay, either one. Number one, many, and you can read this in the news, you can see many doctors and hospitals are dropping certain Medicare Advantage plans that they'll accept because they're tired of being delays in being paid, challenged on their orders, and what they want for patient care will be turned down. They have a very high rejection rate for pre-authorizations, you know. I think somewhere I read it was like almost 30% of doctors who, you know, write for a test or they want to get pre-approval for certain procedures, about 30% are declined right off the bat because it's for profit, okay? Medicare Advantage plans is designed to make private insurance companies wealthy. Period. Now, you can get them without the additional premium. So in other words, like we wouldn't have the Medigap premiums, we wouldn't have the Part D premiums and deductibles, but what would we have? We would have co-pays, and we would have large and high out-of-pocket caps. All right, the plans that I looked at was like $7,000, $8,000. I think the cheapest had like around a $5,000 out-of-pocket max, and then on up. All right. But again, we had to use their doctors, their hospitals, and I'm seeing that, as I said, a number of places are, well, they're just dropping the Medicare Advantage plans. Here's the thing. It's so attractive. They did a lot of great marketing, and about 54% of people signing up for Medicare in the beginning are choosing Medicare Advantage plans. Here's the problem. Another problem. Okay, I was at my insurance agent's office. He's got this big office, and there's a reception area, and he's got a couple ladies working up front, answering questions as people come in and out. While I was there, 2 different women came in. They had Medicare Advantage plans. They needed procedures done, and they were looking at a huge out-of-pocket expense, and they wanted to know, can they switch over to Medicare, traditional Medicare, and take out a supplement? And the answer was, well, you can try, but they will underwrite. You actually have to be approved for a Medicare supplement. And they mean they underwrite it and ask health questions and decide whether you qualify or not. Because there is a certain window when you first sign up, no health questions are asked for a Medicare supplement. All right? No health care. So no matter what kind of health you're in, they're going to take you and you're going to pay your premium and you're going to get your coverage. But I think once you go over 6 months, then you have to, and depending on your state, most states will not allow you to change Medicare supplements, even if it's with the same company. Maybe you want to go from an F plan, which you can't get anymore because maybe the premiums are going up on it too much. Maybe you want to change to a plan N, which is the next best thing. You got to be underwritten. They can refuse. So what do? Well, right now, there's not much you can do. You either pay it, or you drop the supplement coverage, or you take a Medicare Advantage plan out and, takes your chances. So these women were very, very upset over not getting coverage or not being able to switch to Medicare, traditional Medicare with the supplement, because they were told by somebody else that they could at any time. Well, it turns out not so fast, not so fast. So it's a big part of our budget, healthcare. And the thing is, these supplements, by the way, go up. Like my wife's has went up in 7 years. She's been on it for 7 years. Yeah, going on 7 years. 6 years. I'm sorry, 6 years. It has increased 223% in 6 years. So it started out like around $100 a month, and now is almost $300 in 6 years. And it's going to keep doing that. Eventually, it'll be a point. I don't know what I'm going to do except pull a bunch more each year out of our savings in order to compensate for the for that Medigap plan. And furthermore, we can't move her from an F plan to, say, a G plan with a cheaper premium without it being underwritten. And she's not going to qualify. She's not going to qualify based on her health. And I probably wouldn't either at this point because of some health conditions I have. So choose wisely. So the whole point of this video is, one, Medicare is anything but free. It is skinny, what I call skinny insurance, because it doesn't cover all your medical needs. All right. It is, if you choose a Medicare Advantage plan because of saving money, and if you're super healthy and you got a ton of money put back, I mean a ton, that you can afford thousands and thousands of dollars out-of-pocket costs every year, then go that route. But just bear in mind, if you get really sick at some point in your life, where cancer or something like that, that's going to run hundreds of thousands of dollars in treatment, well, you're just out of luck with the Medicare Advantage plan. It's that bad. And I know the government is finally starting to crack down a little bit on the more or less false advertising these companies done. By the way, when you get to be in like 64 years old, you're going to start getting all kinds of solicitations from these guys. I mean, they're relentless. They call on the phone. You'll get it in the mail. Everywhere you look, there'll be an ad or something. In your Facebook, you'll see stuff for Medicare Advantage plans. They market the living crap out of that stuff because it's highly profitable for these companies, but it's not necessarily a good deal for you. But if you're real healthy and got a lot of money, that could be the way to go. But again, talk to a professional insurance provider. So you can see in my situation, right now, currently, $851 a month plus 25% of the cost of her medication. So yeah, that's taking up a big chunk of our monthly budget to cover healthcare. Something I thought was free, something I worked and paid into in taxes my whole life, only to find out it's not that great. It's just not. And there's really no changing it anytime soon. Well, that's it. I would like to hear your healthcare stories in the comments down below. This is Bruce, and I'm a boomer. I'm a recent retiree, and I want to keep posting these videos and building this channel, and I can't do it without you hitting that subscribe button and that like on there as well. All right, thanks so much for watching. I'll see you in the next one.